Good afternoon, everyone. Hello, welcome back to Talking Jobs with me, rbromnick. And today we're going to be talking about occupational therapy. Now, right from the start, just so you make sure you're listening to the right recording, I'm not going to be talking about occupational psychology. That's one of the BPS routes to being chartered. And I'm not going to be talking about occupational health, which is something completely different. We're going to be talking about occupational therapy. And I'm going to start this recording by just telling you a little bit about my mum. I'll tell you about my mum. So, God rest her soul, she's now deceased, but she lived to a ripe old age, and it would have been about 6 or 7 years before she passed away, she had a stroke, quite a major stroke. And as you can imagine, a whole team of professionals came on board into her life to help her. So in the first few days after the stroke, when her care was acute, she had doctors and nurses, as you might imagine. And once she got through that acute period, she then started the process of rehabilitation. And it's never easy, but she met the most incredible team of people. She was left with some physical disability, or I should say physical challenges, but luckily for her point of view, her mental capacity was largely unaffected, her language and cognition were all right. So she met these wonderful rehab professionals, starting with speech and language therapists, and she met physiotherapists, and then occupational therapists. So I'm not just telling you about my mum just randomly, I'm telling you about my mum because she met the most incredible rehab team, and we were everlastingly grateful to everyone from the NHS that helped my mum, but it was the occupational therapists whose work was so important, because what they did for my mum was they helped her get home, and they helped her be independent, and they helped her return to normal back home. Or I should say return to normal. It was return to a new sort of normal. And they worked with such humanity, and they really understood her as an individual, and they asked her to set goals and objectives for being home. And you never get the chance to meet my mum now, but she was completely eccentric. I guess if I was kind, I would say bohemian or something. So when she set goals, these were not run-of-the-mill goals, but it didn't matter. They still worked with her in a way that was energetic and important. And I read somewhere that something like 60% of people who have a stroke can experience depression after a stroke. Not my mum. She found it opened up a whole new range of opportunities and new people to meet, and she entered her rehab phase with a huge amount of zeal and zest for life, and that was due to the occupational therapists. So this is a profession that can make a difference, it can change people's lives, and if you want to think about it, you can make a difference to the individual, but also to all their family around them. So this is just a little scratching of the surface about occupational therapy. If you want to find out more about the profession, other ways of working, and how to get trained up, stay tuned, and we'll meet our very special guest for today. Carol Duff! Yay, Carol!
Thank you.
Thank you so much for coming in. Now, I read your biography. You're like a consultant occupational therapist.
That's right. So I work here at the university 3 days a week, and then 2 days a week I'm still in clinical practice as an occupational therapist.
So when I talked about my mum's experience, I don't know if it resounded in any sort of way with the work you do. Do you think I captured some of what OTs will do?
Absolutely. I think the thing that you captured that was really important is about working in a person-centred way. So often we as health professionals, I'm a health professional, there is an ulterior motive around, for example, getting somebody home or getting somebody to move in a certain way or to be able to do certain things. as occupational therapists, although we may have that in the back of our mind, what we're aiming for, what's really important and what we're really trained really well to do is actually listen to that person and what they want, because actually what they want might be very different to what we want as health professionals. And I think that's some of the essence of how as OTs we work with people.
Oh, that's great. So the example we've had with my mum was about stroke. And I think that neurological rehab might be part of what some OTs do. Can you just tell our listeners a little bit about some of the other areas where people might work?
Yeah, so when you're trained as an occupational therapist, we train people holistically. So we're not just looking at people with physical health conditions or physical impairments. We're trained to work with people with mental health conditions, with learning disabilities.
You work in prisons, I believe?
In prisons, yeah. A whole range of settings right through the lifespan. And I think that's what's really exciting when you train as an OT, that there are all these different options in secure settings, you know, right through to people, you know, with mild to moderate problems and doing preventative activities. So it does give you a whole spectrum of places and different opportunities to work with people at different levels.
Oh, that's great. So you mentioned about mental health.
Yes.
And we're putting this podcast in a little series where we're talking about, I say, different ways of working in mental health. The difference is different to psychology. And I know, Carol, I've brought you in because you've got a lot of mental health specialist interests. So can you maybe just expand on your mental health work and approaches?
Yeah, absolutely. When I trained to be an OT, I was always going to work with children. I found that OT by chance, and before that I was going to be a teacher, so my interest was around working with children. But during my training I got the opportunity to do some placements in a hospital and in a community setting with people with mental health conditions, and I've never looked back. So 28 years in,
Crikey.
I've always worked in a mental health setting in lots of different places. So I started my career working with people with dementia in an inpatient ward. I've worked with various groups of older adults with mental health conditions in day centres, as I say, in their own home. And then also I've worked with adult in community, in inpatient settings, in forensic settings, and I've also done things like vocational rehabilitation, which is about rehabilitating people particularly back to work, so a much more expert sort of area really. So, you know, it's been a really fascinating career, and I've had the chance to work with lots of different people and actually move and change, which again sometimes in other careers you don't have that opportunity to move into different areas and work with different groups of people. But with occupational therapy, you know, it's much more versatile because your core skills remain the same.
Oh, that's great. So what sort of ways would you approach working with somebody? Because it wouldn't be counselling, you know, it wouldn't be that sort of approach to treatment or therapy, would it? So, you know, you mentioned about some of these older adults, or, you know, what sort of things would you do, like a sort of day in a life of working in that environment? What would you do?
Yeah. Our focus, like it says in the title, is around people's occupations. It's around their activities. So if you think about somebody that has a mental health condition, whether it's depression or anxiety, the sorts of referrals would come to me where people are finding that's really starting to impact on their ability to go about their daily life. So as an occupational therapist, you know, it's not that I'm not interested in their symptomology, but my interest is really about how is this stopping you doing what you're doing, you know, and we would be trying to work with that person to either alleviate the signs and symptoms and maybe working alongside our colleagues, but also, you know, actually looking at the functional skills there. So if we take anxiety for an example, there are lots of health professionals who can do anxiety management. So we would be teaching somebody the skills to manage their anxiety. As an occupational therapist, how I would do that would be in a much more practical way. So it would be having a patient learn those skills, but then applying them to their ability to lead their daily life. So, you know, can they get out and get to the shop? Can they take their children to school? Can they get to work? How does it affect them at work? So looking at it much more in an applied way around their occupations and what they need to be able to do and want to be able to do in their daily life.
Oh, thanks. It sounds very solution focused.
Very solution focused. We're very much problem solvers. You know, I think that's why I got interested by it, because I like to find sometimes, you know, solutions to really complex problems that, you know, lots of other professionals have maybe got stuck with. It's quite common as an occupational therapist that people have tried this, tried that. Oh, we don't know what else to do. Let's pass them to OT. Not all my referrals are like that. Some are very specific. But I think as OTs, we can offer a completely different way of thinking about things.
And I just want to ask you, Carol, because we said at the start we're not talking about occupational health or occupational psychology. I want to talk to you about that word occupational, because from our conversation today, I don't think our listeners should necessarily understand that to mean just about the work. Like for my mum, wasn't, you know, we're talking about her being 80 or something. She wasn't going back to work, but I guess her occupation was to be an old lady as well as she could be, if you see what I mean.
Absolutely. And I think when we're talking about occupation as occupational therapists, like I say, we're not talking about a job. A job might be part of that. But occupations are the things you do from the moment you get up in the morning to the moment you go to bed at night, and include sleep. You know, we do a lot of work around sleep hygiene and helping people sleep, and that sleep and activity balance, because we know that has a huge impact on people's mental health. So, you know, you can be working with somebody on one visit around being able to get up and get washed and dressed and do some self-care activities, you know, cleaning my teeth, washing my hair. And at the other end of the spectrum, you can be working with somebody who wants to do something really ambitious, like I want to be a space scientist or whatever. It's about what that individual really wants and aspires to do, and we would work with that.
Oh, thank you. So when I interviewed Rob Gomez about social work, he talked about some of the sort of core values of social work that sort of underpin the whole profession and way of working. I've got that sense from you about the person-centred and sort of solution-focused approach. Do you have any sort of to add about that? What sort of the values would be of OT?
Yeah. I think what's really important is occupational therapists very much believe as humans we have this need to be occupational beings. It's very much part of our identity. It's very much how we live our lives. And I think, you know, occupational therapists do focus in a very person-centred way on what you need to be able to do and what you want to be able to do. Because ultimately when people, if you think about people coming for healthcare provision, so I'm not very well, I turn up at my GP, you know, if it's a simple problem like a course of antibiotics, I'll get the antibiotics, I'll be on my way. For problems that are much more longer term, yes, I want some of the symptoms to go, but what's most important to people is I want to get on and live my life. I don't want this to stop me doing what I want to be able to do. So it's about, you know, looking at that and not only looking at recovery, because we know for some health conditions people can't recover and won't recover, but it's how can I live my best life in these new situations, a bit like your mum.
Yeah,
you know?
I definitely got that sense.
So not going back to being what normal or whatever normal is or how I was before, but actually how I live with this. So thinking about a mental health setting, you might get somebody with a psychotic disorder, you know, which is, you know, fairly complex to treat, but people will recover. But, you know, those early stages are learning to live with and manage my life and my activities to the best of my ability, you know, with that health condition, because we know the knock-on effect if people can't do the things they want to be able to do, their mental health worsens, you know.
For sure.
If your mum had a stroke and was severely impaired in what she was able to do, you know, like you said, the likelihood is she might become depressed and anxious. So again, you know, working in older adults, for me that's quite, we get a lot of patients that come through that it has been the physical health condition that started as a problem. They maybe haven't had the opportunity to see occupational therapy at that point, so haven't been unable to live their life, and again come to me maybe, like I say, with some anxiety and depression and a physical health problem. So again, looking at them holistically, not just...
But people with quite complex sort of
absolutely.
needs. Oh, that's really interesting, Carol. So what about training? So I've brought you in because I know we run the course here and you take on people who've already got a degree, and psychology might be a good degree. So I'm going to go back over to you. Can you start by telling us a bit about the postgraduate training routes?
Yeah. So the postgraduate training route in Lincoln, we established and started our first cohort in January 2019. We've got a second cohort starting in January 2020. But the routing for that is for people with, we talk about a relevant degree, and you have to have some basic GCSEs, 3 GCSEs in science, maths and English. So it's not a huge requirement from GCSE, but we do need a bit of a science background. But certainly psychology would be a very relevant degree, thinking about how we work with people and understand people and the nature of their behaviour. So it is a 2-year programme. That is a fast track programme compared to other undergraduate registration programmes, which are a 3-year programme. During that time, during the 2 years, you will do 1,500 hours of clinical practice. Right. And that will be built around your academic modules. So
they'll be at university to do some modules and then out on placements and so forth.
And your placements will primarily be in Lincolnshire, but we know for people who live in surrounding areas, we would try and accommodate, you know, those placements in those surrounding areas, because we have a real good network of practice educators that want you out there and want to employ you when you qualify.
Yeah,
we've got people desperate, you know, to give our occupational therapy jobs.
Yeah, I had a little look on the NHS website, jobs website. There's lots of vacancies, and when they do the placements, would people work in those different areas like children and older adults?
So for the 1,500 hours, there's 5 blocks of placements. Now, what we would do through that is plan that you get some mental health experience, some physical experience, because obviously we work in those physical environments. We would try and look at some different age ranges, so maybe you might get adults and children, or adults and older adults. What we also offer in the second year, because again occupational therapy is a profession that's really developing, is something called a role emerging placement. So you would go out in pairs to an organisation that we would work with and prepare them to support you, but where there actually isn't an occupational therapist, and it would be about helping and supporting you to look at how an OT could work in this area. And again, you know, there is a big drive certainly around prevention, public health, because at the moment a lot of occupational therapists sit within specialist services, which is great, and we need OTs there, but we know with our skill set, actually, if we got people earlier, we could do a lot of preventative work, but at the moment there's not a lot of commissioning there yet, and that's the thing, that the evidence base is growing in those types of areas. And as students, you know, right across the UK, not just on our Lincolnshire programme, these role emerging placements have led to more roles being created. So
that's great.
For an example, we have occupational therapists commissioned in some areas now to go out and work with paramedics, with people who've fallen, doing that early intervention, preventing people going into hospital. We've got occupational therapists working with the fire service, you know, where they come across frail older people or people with health conditions that might need some additional support that actually haven't hit healthcare services yet. We've got occupational therapists working in horticulture projects on farms, doing therapeutic work with people with additional needs there. So, the spectrum of what you could be doing is huge,
Oh, that's great. So people will need that degree.
Yes.
And ideally some kind of experience of working in a healthcare setting or
Yeah,
so forth.
absolutely. We would always ask if somebody's got some experience of a healthcare setting and ideally had at least one or a couple of insight days with an occupational therapist so that you really understand what that role is. Obviously, if there is anybody interested, I'm quite happy for you to get in touch with me. I'm on the university email, and we can link you in with an occupational therapist, because I know it's not that easy to find an OT, but certainly we've got practice educators out there that are willing and interested in people being able to spend a day with them to understand what the role is about.
Oh, it's fantastic. I think it could be very appealing for a number of our students, those of them that have that good science background, but also perhaps maybe more looking for sort of practical or hands-on work. It sounds really, I would love it. It sounds so exciting.
You'd make a good OT,
Oh,
Rachel, you would.
Oh, well, in another life, or maybe in this one, but certainly our listeners really, I have tried to be impartial with these series of careers recordings, but I have to say, like on YouTube when someone recommends a mascara and they have to say, oh, they meant to say they've been sponsored. Well, I'm not being sponsored to promote OT, but I genuinely think it's a fantastic career. So please, everyone, listen in and try to meet up with Carol or send her an email. Do some research about the profession. You'll find all kinds of different interesting ways that you can really make a difference in someone's life. So, with no further ado, it's time now to say goodbye. You've been listening to Talking Jobs with me, Rachel Bromnick, and our guest, Carol Duff. Bye, Carol.
Bye. Thank you.